How's it going, guys? We have a past level question for Immuno for step one. I've made clips on this prior. Some of you might think this is too easy. I don't really know what to tell you. Okay, it's high yield. We have to focus on important points for the exam. Before we start, please subscribe to my channel. I really appreciate it. Give me a like, really appreciate it. Follow me on Instagram, Mehlman_medical, MEHLman_medical. Links down below for me on Telegram. Links to the Telegram group channel down below. Now start the clip. 32-year-old man. His temperature is 103 Fahrenheit, heart rate 100, respiratory rate 16, blood pressure 90/50. Leukocyte count 24,000, should be 4 to 11,000. Physical exam shows a right lower lobe consolidation with dullness percussion, which the following is most saliently responsible for the patient's hypotension. So we have septic shock here, presumably secondary to a strep pneumonia. Okay, if we had bilateral interstitial infiltrates, that could be mycoplasma. Very rare for that to cause sepsis, but we have low blood pressure here, and the patient wants to know, what the fuck am I saying? The question wants to know which the following cytokines listed is most saliently responsible for the low blood pressure. Let's just hop through. Choice B, IL-1, wrong fucking answer. Okay, so this is going to be fever on USMLE. Some of you watching this might say, Mike, I did my bachelor's in immunology and IL-1 can cause hypotension. That's great, but it's fucking wrong for USMLE. Okay, they want IL-1 for fever. Now, as I've talked about in prior YouTube clips, you've been following my content, you know I've discussed this. There's a question on one of the NBME exams where they say a patient has fever and they say an NSAID was given to mitigate the fever. IL-1 is wrong. The answer is prostaglandin in terms of what was responsible for the fever. Student says, oh, I thought you said IL-1 was fever. It is fever, but you have to use your fucking head. If they say an NSAID was given, which knocks out COX, which knocks out prostaglandin synthesis, it's prostaglandin that they want most directly for that question. But for septic shock, okay, they'll say a dude cut himself in his backyard, he's got sepsis, and they say, which the following cytokines responsible for the fever? Answer is IL-1. In this case, wrong fucking answer. Choice B, IL-2, wrong fucking answer. What you need to know for USMLE is that this stimulates T cells. Okay, for every cytokine here, there could be 50 things it does, all right? But IL-2 for USMLE stimulates T cells. And the focus on USMLE is actually which drugs / agents will decrease T cell response or decrease IL-2 responsiveness or synthesis. Okay, so the immunosuppressants, cyclosporin, tacrolimus, sirolimus, those are going to decrease transcription of IL-2 / responsiveness to IL-2. And steroids are going to decrease T cell response. There's other more recondite medications that have lower yieldness for USMLE, i.e. daclizumab, basiliximab, holy shit, that will block IL-2 receptor, non-existent, wrong fucking answer. Choice C, IL-6, wrong fucking answer. Garbage interleukin for USMLE, okay? You could know peripherally, if you care, that it can stimulate acute phase protein release by the liver. You can conjecture that this plays a role in osteoporosis, even though IL-1 is more important for osteoporosis, tangential discussion. IL-6 inflammation, as far as there's an obscure drug for rheumatoid arthritis called tocilizumab, which blocks IL-6 receptor. Garbage drug, wrong fucking answer. Choice D, TGF-beta, wrong fucking answer. So numerous things this does. The two things that show up on NBME that I've observed, number one is TGF-beta and IL-10 are both considered anti-inflammatory. Okay, which is a little bit weird because they can stimulate inflammation regarding some other pathways, but they want you to know TGF, if they list a bunch of interleukins, just like I did here, okay, and I said, which of the following is going to decrease an immune response in this patient? Answer would be TGF-beta, okay, or IL-10. The other thing TGF-beta is going to do is it's responsible for extracellular matrix turnover. So that's literally what they'll do. They'll give you some patient who had some sort of wound and that there's remodeling of the extracellular matrix. They'll say which of the following is responsible for facilitating remodeling of the ECM in this patient, and the answer is just TGF-beta. Wrong fucking answer. Choice C, TNF-alpha, correct answer. You need to know TNF-alpha is responsible for hypotension, vasodilation, increased vascular permeability, and sepsis. It's most saliently responsible, okay? So as I mentioned before, question on one of the offline NBMEs. Actually, no, sorry, it's not offline. An online NBME, they tell you, dude cut himself in his backyard, he has sepsis. They say, which of the following two cytokines / chemokines are responsible for sepsis? Answer is IL-1 and TNF-alpha paired together. They'll give you the same fucking question, and then it'll say, which of the following responsible for vasodilation in this patient? Which of the following responsible for hypotension in this patient? TNF-alpha. Okay, so I make it very clean and simple Because if you read about these cytokines in textbooks, they'll tell you like 7 different things that they do. Bunch of nonsense, waste of time for USMLE. Okay, so IL-1 is going to be fever, TNF-alpha is going to be vasodilation, vascular permeability, hypotension. TGF-beta is going to decrease immune responses, suppress inflammation, and as well as stimulate extracellular matrix homeostasis. IL-6, acute phase protein release by the liver. IL-2, T-cell response. You know the deal. I'm going to make more content. If you like my stuff, subscribe my channel. I appreciate your time. That's it.